Hello and welcome to WVU Medicine Tuesday Talks. I'm your host, Mary Ravazio Menard. The Medicare annual enrollment period is underway, and if you're on Medicare in West Virginia or know someone who is, this is the Tuesday Talk show for you. West Virginia-based health insurer Peak Health is now offering a new option for Medicare-eligible West Virginians. It's called Peak Advantage Medicare, and it's the only Medicare Advantage plan in the state made by and for West Virginians. Medicare Advantage plans provide access to Medicare coverage and additional services that are not covered by Medicare. So today, we're talking about the benefits offered by the Peak Advantage Medicare plan with Amos Ross, Chief Operating Officer of Peak Health. Welcome, Amos, to Tuesday Talks.
Thanks for having me. I'm excited to be here.
Yeah, we're happy to have you here. So this is the only Medicare Advantage plan made by West Virginians for West Virginians. So who designed and created this plan, and why is that important?
Yeah, it's a great question. And I think in order to answer that, you need to start with, what are we looking for from an insurance company, right? And, the name on the card doesn't matter maybe as much as you would think, based off all the commercials and advertising that you see. What people are really looking for is the fact that when they walk in their clinician's office and they pull out the card, they're able to see the doctor that they want to see. They're not really hit by a bunch of sort of costs that they weren't anticipating, right? And we know our system is incredibly complex, and sometimes you're going to have an issue, and knowing that you have somebody who could be a partner to help and solve those issues, I think our plan that we've created helps address each one of those things. So I'll just touch a little bit on how, Peak does that. So that first one, right, when you talk about access, at your doctor's office, because we're owned by health systems, we can always ensure that you're always going to be able to see the clinicians that are part of, WVU Medicine or other provider owner partners.
Okay.
And that's really critical. And then I hope to get into this a little bit further when we talk about the product. But we're really excited about the way we've crafted a product to give people a lot of flexibility and ownership over how they use their benefits and how they sort of control some unexpected costs. And then lastly, when you call Peak, when you have an issue, you're talking to somebody local, right? The same way your care is delivered. And a lot of other Medicare Advantage plans, you might be talking to somebody not even in the same country.
Yes.
It's hard to understand.
Which can be frustrating.
Incredibly, right? And because we're partnered with our health system owners, you don't get that, well, you need to talk to your doctor, you need to talk to your insurance company. We can kind of jump in and resolve it, but you also have somebody on the other end of the phone who's in the community as well. And I think that's really critical.
So that's less red tape.
Yeah, for sure. I mean, that's the objective. I mean, that's what I want, right? And so we're trying to give folks in the community, in our Medicare population, that, the same things that we're looking for in our insurance company.
Good to know. All right. Now, so Peak Health is the only provider-owned, provider-sponsored Medicare Advantage plan. So what is the benefit of that connection? That we're kind of homegrown, really.
Yeah, and I think that starts with trust. And if you think about, the relationship that you have with your clinician, we share things about ourselves that, are incredibly private, sometimes things we don't even share with our family. We trust them to help us, navigate some of the most difficult challenges that we face in our life, right? And we put a lot of trust in that relationship. And at Peak Health, because we're not, a standalone insurance company, we're built around the health system, right? We're taking that relationship that you have with your doctor and saying, that's the most important and critical aspect of care. And then Peak Health sort of is behind the scenes, Peak Advantage, saying, we want to make sure your claims get paid efficiently. We want to make sure you understand your benefits. We want to make sure you have a great product. We want to make sure that you have a partner when something goes wrong, but giving primacy to that relationship that you have with your clinician.
So this health plan was created well, it's sponsored by WVU Medicine and Marshall Health, right?
That's correct.
Okay. So basically, it's created and run by the health systems you already know and you're familiar with, and it's supported by the doctors who treat you, because the doctors had a say in putting this plan together too, right?
Yeah, that's exactly right. And it's funny. We were having a conversation with a clinician in the system, and he's like, with Peak, we have a seat at the table. And I was like, well, no, actually, you've given us a seat at the table because it's your table,
Yeah.
and we're here to sort of, say, how do we support you? How do we take, our clinical standards and sort of the quality care that we deliver and wrap an insurance product around that, not sort of retrofitting something, externally and saying, here's a model, you have to work within it. It's actually the opposite. And, I think that sort of level of involvement, that sort of level of clinical engagement in sort of our product, and also what we do from, a medical policy, medical, standards perspective, means that there isn't that sort of friction between the insurance company and the clinician that exists in a lot of other relationships. And so I think that's a really key differentiator.
Yeah, it makes a big difference. So let's talk a little bit about the benefits of the plan. Let's start with talking about, it's called Peak Advantage Vista PPO plan. What are the benefit highlights of this plan?
Yeah, so you remember, we talked about like one of the things that we really want from an insurance product is, we're not getting hit by surprise costs.
Right.
So the benefits of the Vista plan start with zero, which is the lowest cost possible, of course. So
everybody likes that.
Yeah, so when you think about a zero as your monthly premium, that's a great place to start. When you think about zero to see your PCP, when you think about zero for copays on most of tier 1 and tier 2 drugs, right, which are a lot of the sort of really popular medications, I think that's a really, really strong starting point. And then you supplement that with sort of zero as preventative coverages. So that includes, your flu shot, mammograms, prostate screening, colon cancer screenings. That also extends to, diabetics supplies, right? Because that's important.
Yeah, sure.
That we want folks to get that preventative care. So glucometer, lancet strips, all those things, those are all covered at zero too. So yeah, zero. That's
zero. Yeah, and it's zero premium too, right?
Yeah, that's right. Zero monthly premium.
Wow, a lot of zeros.
That's right.
That's a good thing. Can you talk a little bit about the prescription benefits on the Vista plan?
Yeah, so I mean, prescription benefits, of course, we all know, right? There's an endless array of drugs that are coming out every day, and it seems like all of them have increasingly high costs. And so, basically, our plan is structured like most prescription, plans, and that we have tiers. And
Sure.
And I think for everybody who's, evaluating our plan, they should know, zero copay on tier 1 or 2. Most of the drugs that you use are going to be on those tiers. But if you do have something that's a little bit unusual, it'd be important to just, check. And do due diligence to see what tier that falls into.
Yeah.
Because there are slightly higher copays on that, but nothing extraordinary.
Okay.
But it's just important that
To know that.
and be equipped with the right information as you evaluate your options.
What you can expect to pay for your medications, sure. Also, the $0, you mentioned that a little bit, you touched on this earlier. There's $0 copays on preventive services and support. So what type of preventive services are $0 copays?
Yeah, I mean, I think that's something that, we're excited about in the product this year, and probably you'll continue to see us invest in, which is, we're looking to move to sort of more of an outcomes-based model, right? And we say, how do we sort of ensure that our members have access to the care that they need up front, right, to prevent those issues from occurring later on down the road.
Yeah.
And so a lot of those key, screenings, a lot of those key, annual wellness exam, a lot of the, like I said, the flu shots, a lot of the, cancer screenings and things like that are all sort of covered into that, zero preventative schedule. The list is pretty exhaustive. So, I would encourage folks to go scan, and I think you'll be pleasantly surprised at how much is covered in that. As we say, we want you to receive this care because it's critically important, and because of that, we're making sure there's not a cost to you when you receive it.
Great, good to know. So what about the dental plan part of the Vista plan? I mean, what are the dental benefits like?
Yeah, would it shock you if I said that there's a zero involved in that?
Not now.
So,
that seems to be the running theme here.
Yeah, again, when you talk about those preventative cleanings, sort of the normal, dental care that is so critically important, there's zero copays on that as well. And then there is a broader dental benefit that if you do have services that you require, and so, there is co-insurance that comes into play on that. But I think that sort of model is we want to make sure, that you go get those sort of preventative things. And then as you start to need those more complex services, that's where another key benefit that we have comes into play, which is our Flex Card. And I know you're probably going to chat about this a little bit more.
Well, no, we can talk about it now. What is a Flex Card and how does that work?
Yeah, so a Flex Card, if you think about it, is really like, we design a plan and we come up with all these benefits that we think are critical to helping, folks be the healthiest and best versions of themselves that they can be, right?
Yeah.
But we don't know everything, right?
No.
And so the Flex Card is a little bit like taking some of those benefits and giving them back to the member and saying, every person is unique, every person is different. And so on the Vista plan, you have a $250 Flex Card, and you can use that when you have sort of a cost that pops up that maybe you weren't expecting, or maybe you need some sort of services. So let me give you an example.
Okay.
So maybe you need to see a specialist, right? And
Yeah.
our specialist copay on Vista, which is the zero premium plan, is $25.
Okay.
It's the lowest in the market, but that's still $25.
Yep.
You could pull out your Flex Card and say, I want to use that to pay for my copay. And now you can see a specialist, right? And there's no out-of-pocket cost for you. Similarly, maybe you go to the dentist and they do the cleaning and say, hey, we have to do a cavity or filling or something like that. Well, you can pull out your Flex Card and use that to sort of pay for that. So there isn't an out-of-pocket cost to you.
Okay.
So it's really a great tool to say, if you're ever in a time throughout the year where you have to receive some care and you're like, man,
you weren't expecting
this cost pops up and maybe I don't have that, whatever it is today, the Flex Card provides you that option to make sure that you're able to receive that care. And, like I said, gives just a really great option of flexibility. As it's in the name, right?
Yeah, like a safety net.
Yeah, exactly. And we think that's a really critical part of the product offering, and probably something that you'll see, us continue to invest in over the years.
Great. Okay, what about vision? Everybody, I think.
Yeah, we're both wearing glasses.
Yeah, we're both here, sitting here wearing glasses. I want to know about the vision plan, but I'm still too young for this. But
yeah. It's another zero.
Surprise.
So if you go to get that annual eye exam, it's zero. And then there is a hardware benefit, of course, that kicks in, depending on what frames you get or not get. I'm always shocked when I go to pick out my glasses and you pick out the frames and you're like, oh, not those ones.
Yeah.
Again, it's sort of structured around like, it's zero for the preventative piece of it, and then there's a benefit. But guess what? If you do get to the end of the year and you're like, hey, I've got this Flex Card, you could use that there.
You can use it there.
Yeah, so it shows.
The Flex Cards for just has to be health-related expenses.
Yeah, I mean, the only thing it really doesn't extend to is pharmacy right now. But for pretty much everything else, you can use it.
Okay.
And that's just a really exciting option around
Yeah.
creating flexibility for people.
So we could use it for dental or vision, and there's hearing benefits too, right?
Hearing benefits, yeah, I think this is something, that, you continue to see sort of, the sort of technology continues to improve. And so for folks who do have hearing loss, adding this benefit in is really great. And when you go to get the hearing exam, guess what? You pay zero.
Zero.
Yeah. But, and then if you actually need some hardware, there is a co-insurance again. But yeah, it's, I think that's a key differentiator, right? When you think about, there's a lot of people who have original Medicare, and you think about that sort of narrow product offering, which is, kind of your medical benefits portion of it. And then you usually have to get, some sort of supplemental policy or Medigap for prescription coverage or for dental or vision. We sort of wrap all those things into a single product, right? So now you get your medical, you get dental, you get vision, you get hearing, and guess what? We also offer fitness and transportation as well. And so it really is this holistic product offering that you get sort of all centralized through Peak. And I think that's really a key differentiator, relative to original Medicare. And then if you just look, relative to other, Medicare Advantage plans, I think our product and the benefits are the best in the market. I encourage everybody to do due diligence to make sure that it is exactly the right plan for them. But I really like where we are and sort of what we've been able to put into this product for people to help them sort of, like I said, be the best and healthiest versions of themselves that they can be.
Yeah, it really makes a difference being a homegrown plan.
Yeah, I mean, for sure. It's incredibly exciting to be a part of it. It's funny, like, I'm originally from West Virginia, and, born and raised here. My parents have retired to North Carolina, and when I was telling them, about the Medicare offering that we have, they're like, I wish we could have something like this. But, no plans to expand to North Carolina anytime soon.
Not yet. Maybe someday. So when we were talking about these different benefits, this was for the Vista PPO plan, but there's also the Summit PPO plan. Can you tell us what the difference is between those two plans, and what if you decide to sign up for the Summit plan, what could you expect?
Yeah, I mean,
in general.
So, the difference between Vista, which is a zero monthly premium plan, and Summit is that there is a monthly premium. It's $18 a month, so it's not a ton, right?
Right.
But basically, with that $18 a month, we use it to put back into the benefits, and so you get all of the things that you get on Vista for sure, but you'll see slightly lower co-pays when they actually do show up, right? And slightly lower out-of-pocket costs. And so, I think it's just an option for folks, right? To say, if you're going to have some consistency, or you maybe there is care that you need, maybe having that sort of $18 that you pay every month in advance for those
worth it for you.
It's worth it, right?
Yeah.
So I think when you go through the process of evaluating the products and talking to a licensed agent, they'll walk you through that and sort of help you make the best decision and get you enrolled in the right plan. But that's really the key difference. It's like you pay a little bit more and you get something that's just slightly better, right, from an out-of-pocket cost perspective.
Okay, good to know. And can you talk a little bit about the general benefits of the Builtin Part D drug plan?
Yeah, so we talked about that before, right? Original Medicare, you don't really sort of have that prescription coverage, so there's a supplemental plan. With Peak Advantage, it's all together, right? So you get a sort of combined benefit offering, and then, you obviously get sort of, all of your prescription coverage through Peak. And then it also extends, of course, to better coordination in terms of those benefits, right? Because now you sort of localizing that within the same sort of four walls where, we have our clinicians and our pharmacists working together versus another third-party insurance company that's being engaged. And so, are there other plans that offer similar benefits from a prescription perspective? Yes. But you kind of lose that coordination.
Right.
And I think that's really a critical piece, especially for how complex, our healthcare system is today, is you really want an advocate and you really want a single place to go to when you have something. And
keep it simple.
Yeah, and when you call up, you really want that one person to be able to equip to solve those issues for you. And so by consolidating and bring that in with this larger, Medicare Advantage offering, that's what we offer, right? Simplicity, and then we also offer that single, voice to the member.
Yeah.
They call us, and we take care of it.
It's easy peasy, right? Oh, and there's like interesting extras to this too. I mean, this is the one transportation assistance and gym memberships. Transportation assistance, how does the plan help with that?
Yeah, so we talked about what we want from an insurance company, right? And about the surprise. And sometimes an obstacle to receiving care is actually getting to the appointment. And so through the transportation benefit, there's a certain number of rides that you can get to sort of get you to those visits and make sure that you're able to get that care that you need and it's covered as part of your plan. And then from a fitness perspective, I mean, we all know how incredibly important, staying active is. And there's coverage for that. There's, facilities all over that you'll have access through. It's really a very deep, network from a fitness perspective. So I think, folks that are interested in that benefit, when they call up and chat with us, they'll be pleasantly surprised at how many places they can get into and continue to sort of, have access through this plan.
Okay, so how do people enroll or get more information on this plan?
Yeah, so I mean, the first place they can go is to medicare.peakhealth.org, right?
Okay.
That's our website. And that's a great place to start. There's a ton of information out there, and folks can sort of self-navigate, right? And sometimes it's just a good, place to start to learn more and see all the benefits sort of spelled out and sort of, understand that.
Take as deep a dive as you want to.
Absolutely. And if you're, incredibly empowered, you can even enroll yourself right there through our website, which is pretty amazing. But it's pretty complicated, right?
It can be.
And so sometimes it's nice to have, somebody on the phone that you can call and sort of, talk through. So if you call us up at 866-850-2603, we have licensed agents who are available from 8 to 8, 7 days a week to take your call and to help you sort of better understand those plan offerings and figure out what's right for you.
Okay, great. So before we wrap things up, I want to ask you, what is the most important thing you want our viewers to know about the Peak Advantage Medicare plan?
I think we covered a lot of it, right? Which is like what we're striving for is to provide that, ideal experience for, the consumer, for you, for me, for anybody, which is, ensuring access, not surprise costs. And if something does pop up, hey, we've got this pretty cool flex card that you can use to for anything really, right? To sort of protect yourself a little bit for those costs. And then we have that sort of local connection, which is when something does go wrong, you can call us up, right? And we'll help you figure it out and be that partner for you. I think that's the most critical thing that we brought together in this plan, wrapped around great benefits, but it's that locally, owned and operated sort of connection that we have, which is, why we're asking everybody this year to come home to better Medicare.
Yeah, it's here.
Yeah.
Thank you, Amos, for sharing all this information with us. And if you want more information, they can go to the website and call the number, which will be on the screen.
Yeah.
But thank you for sharing this information. So that brings us to the end of this edition of Tuesday Talks. If you're looking for more information about Peak Advantage Medicare, visit peakhealth.org/Medicare. And join us on the next Tuesday Talks on November 7th, when we'll talk about limb preservation with Dr. Samantha Mink, vascular surgeon at the WVU Heart and Vascular Institute. I'm Mary Ravazio Menard, and on behalf of Amos Ross and everyone at WVU Medicine, thanks for joining us.